Remove jewelry and perform hand hygiene. I have prepared my equipment and I'm going to start the procedure. I'll make sure that my mask is tied securely and I will ensure that it covers my chin and is not loose. I'll pinch the nose so that it doesn't move up. Put on the goggles, or you could use a mask with a shield attached as it's shown in this image. I will need a sterile and intact packet of gown. I will open the pack by only touching the corners and ensure that I am not crossing over the sterile field but going around the trolley. The whole trolley has to be covered. Get the appropriate sized glove, ensuring the packaging is intact, confirming sterility. Make sure not to rip the packaging. Open it away from the sterile field and flip it onto the field. This is the only time in theatre that you would do the flipping method. If you are scrubbed and need an instrument, ask a co-worker to hand it to you as shown. Now I'll perform the 5-minute scrub. Open the scrub brush packaging carefully, making sure not to touch the contents. Fold the plastic under the brush and place it next to you. Wet your hands under running water past the elbow. Apply the disinfectant according to the manufacturer's recommendation and apply more if needed to ensure that you fully cover your arms. Apply the cleanser 2.5 centimeters above the elbow. The 1 minute starts now. Under running water, use the nail pick to clean under the nails. At the end of 1 minute, discard the nail pick and wash your hands. Wash hands by going in one direction only. Pump more disinfectant and fully apply the product to 2.5 centimeters above the elbow. The 2-minute step begins now. Apply more product to the scrub brush. Using the sponge side, scrub the nail beds and the hands thoroughly. Make sure to keep your elbows below the hands at all times. Scrub between the fingers, the palms, and back of the hand. Now do the same for the other hand. At the end of the 2 minutes, discard the scrub brush and using a circular hand movement, wash down the product to the forearm. Do not go from elbow to the wrist. Then rinse your hands from the fingers to the elbow, ensuring that you use the same one direction technique. Be aware of your surroundings, and if you do touch anything, the stage must be repeated. Apply more product to the hands, lather, and apply only to the forearm. The next 2-minute step begins now. Make sure to wash between the fingers, palms, and back of the hands. At the end of the 2 minutes, scrub down to the forearm in a circular downwards fashion, ensuring that you do not move back upwards. Then rinse your hands thoroughly using the same one direction technique. Let the water drip off your hands before moving over to your trolley. Take one of the towels and using one corner, dry your hand. Then using the opposite corner, dry your forearm down to your elbows. Make sure that the towel does not touch your scrubs. Using the second towel, dry your hand with one corner. And use the other corner to dry the forearm. Always dry in a circular downwards motion. If you come across a facility that uses one towel, you will need to utilize the four-corner method. Pick up the towel and using one corner, dry one hand. And using the adjacent corner, dry the other hand. Now flipping the towel over, use one corner for one forearm and using the adjacent corner, dry the other forearm. Make sure that the towel does not touch your scrubs and always dry in a circular downwards motion. Pick up the gown like a book and holding the spine, insert your hands into the gown and open them out. The gown should fall open and you can push your hands through. Then get your co-worker to tie the back strings. Make sure that you are aware of your surroundings and ensure that your gown does not touch anything. Always have your hands remain inside the gown and that your fingers are not visible. With the cuffs covering your fingers, carry out the closed gloving technique. Firstly, unfold the glove packet and maneuver it so that the fingers are facing towards you. Using your dominant hand, place your hand on the appropriate glove and pick it up with your thumb under the folded part of the glove. Flip it over onto your hand and maneuver your fingers into the glove. The white cuffs of the gown should not come out from under the gloves, so ensure you pull the gloves down as far as possible before pushing your fingers through. Using your non-dominant hand, grab the folded cuff of the glove and repeat the same process. As your other hand is sterile, you are able to touch the glove to assist you in getting the second glove on. Make sure that the cuffs are tucked under the gloves. In theatre, you will don a second pair of gloves for further protection. To tie the front of the gown, pass the person the tag and turn to your left in an anti-clockwise direction. Grab the second string from the person and do not touch the tag. Now tie the strings. Note that your sterile zones are from the tips of the fingers to the elbows and from the chest to the waist. This is the stance that you must now take in theatre. Once the surgery is over, this is how you will remove your soiled attire. Loosen the ties and pull the gown forwards using force. Then fold the gown onto itself and discard it in the bin. Remove your gloves, ensuring you are going from dirty to dirty and clean to clean. Try not to flick the gloves. Discard the gloves in the bin and perform hand hygiene. And then remove your goggles and mask. Perform hand hygiene again and the decontamination process is complete.